Well, these are pictures of his life. So this is he and his daughter, Emery, and she was just his little pride and joy.
Steve and Becky Lawwell are showing you photos of their only son, Olson.
He was an interesting character. He was very talented at everything he did, but you couldn't tell him.
No, you could not tell him, because once you said something like, Alston, that's really good, it's like, I'm going to be expected to do that some more. And so it's almost as though he would sabotage it. Yeah. But yeah, here's his siblings.
Alston would have been 29 this year. He died on November 25th.
He, over the past maybe 2 years, just started acting different. He was in a successful job at that time. And all of a sudden, he just started looking different, acting different. When he would come here to visit and go to the beach with the family, he was in his own world on the phone. And everybody else was having fun, and there he is, just kind of isolating himself.
Yeah, we knew he was hiding something. We just didn't know what it was.
Addiction. Alston's wife said he started doing cocaine, then opioids near the beginning of the pandemic. The self-prescribed medications took control of his life rapidly. Within a matter of months, the 28-year-old husband, father, and son, who had always lived with family, found himself living alone during a pandemic in Lansing.
He was only communicating with his wife at that point, and she hadn't heard from him in 3 days. So on November 25th, she called me and she said, I'm very concerned about him. And so just before I got there, she called and said that he's gone, that they'd found him. So, you know, it was much worse than we ever imagined.
It was a gut punch. I remember hearing it, that he was gone. I mean, he was the youngest of the 4 kids, and he was gone. What?
This police report shows one day before Alston's death, he messaged a friend about buying 3 grams of cocaine. But according to his autopsy, it was fentanyl that led to his heart attack. Fentanyl is a synthetic opioid approved for treating severe pain. It's highly addictive, and its potency makes it extremely lethal. How lethal? According to this Sparrow Hospital's medical examiner report, fentanyl overdoses took 134 lives in mid-Michigan in 2020, far more than any other drug. And of those 134 overdoses, including Alston's, 90% were accidental. The truth is, these victims have no idea how much fentanyl they're taking and that they're about to die.
But it looked like there was no intention at all. There was no note. There was a bag of Wendy's in the microwave, you know, so he was heating up his lunch.
Fentanyl is popular with drug dealers because a small amount goes a long way, making it easy to transport without getting caught. Accidental overdose rates continue to rise because drug dealers are lacing their products with fentanyl in many forms.
So we have a couple of different forms when it comes to fentanyl. This is fentanyl mixed in with heroin. This is liquid fentanyl. This is a combination of fentanyl as well as meth as well.
Lieutenant Alexic with Tri-County Metro Narcotics confirms it's common for people not to know fentanyl is in their drug.
When you're getting your drug and you think you might be buying one drug, you're getting another, you don't know what's in it. And fentanyl is 100 times more potent than, for instance, morphine.
That means fentanyl, often compared to heroin for its euphoric effects, only requires someone to take 2 milligrams to overdose. How much is 2 milligrams? Well, it's barely enough to cover Abraham Lincoln's beard on this penny.
It's very, very dangerous.
CDC data shows fentanyl use has been growing steadily for 10 years in the United States. Narcotics teams are working to take fentanyl off the streets. But what can be done to save lives in the meantime? I asked Dr. Ju Park, an epidemiologist at Johns Hopkins University. She conducts research on drug overdoses.
Is it realistic to say that we are going to be able to take fentanyl completely out of the illegal drug market?
I would say based on historical data, it's not very realistic. This approach of relying on just reducing the supply and, getting rid of drugs and saying no to drugs, that has been tried for many, many decades, and this is where we're at.
Dr. Park says if people are going to take drugs, let's offer a way to be safer with them. Harm reduction. She and colleagues from Johns Hopkins Bloomberg School of Public Health and Rhode Island Hospital did a study on one major safety option.
So we conducted a study that looked at, first of all, the accuracy of fentanyl test strips. They are just very simple immunoassay-based strips that rapidly tell you whether your sample of drug solution or drugs mixed in water contains fentanyl. And we found that these tests were 98% accurate in detecting fentanyl in solutions.
That means if some victims, like Olson, had used these strips and known the amount of fentanyl in their drug was unsafe, they may have.
Throw away that drug, or maybe they decide to use slower than they usually do, or reduce the amount, or ask their friend to help them if they are to overdose, to help revive them with naloxone.
Fentanyl strips are a legal option in Michigan. Currently, they're limited in supply. Your best bet at finding them are at harm reduction programs.
It can be a point of entry for people who are interested in treatment or talking to someone to address their mental health.
As for Alston, the boy who always chose for himself what path he would follow, Steve and Becky hope hearing his story can help another struggling person out there. They take solace in saying they know they'll see their son in heaven again soon.
We came across the rest of his senior picture proofs. And when I showed Steve this, it was almost like he just wanted this framed. And it's Alston on a train track, almost like, I'll see you later. I'm on my way.
That's Alston on the rails. That was our hope, that he would stay on the rails.